Are you a man over 60 who finds yourself waking up multiple times at night, rushing to the bathroom and still feeling like you can't fully empty your bladder? Maybe you've noticed that little dribble after you finish, or the weak stream that takes too long. It's frustrating, it's exhausting, and it can even be embarrassing, but you are not alone. More than half of men over 50 and almost 9 out of 10 men over 80 deal with this problem every single day. The good news is there are safe and effective treatments that can make a real difference. And today we're going to talk about the best medication for an enlarged prostate, one that helps you take back control while keeping side effects to a minimum. As men get older, one small organ quietly changes, the prostate. Normally, it's about the size of a walnut, sitting just below the bladder and wrapped around the urethra, the tube that carries urine out of the body. When we're young, it rarely causes trouble, but with age, the prostate often grows larger, and doctors call this condition benign prostatic hyperplasia, or BPH. At first, this growth seems harmless, but imagine squeezing a garden hose while water is running. The flow weakens, sometimes it stops and starts, and pressure builds up behind it. That's exactly what happens inside the body when the prostate presses on the urethra. Suddenly, urination is no longer smooth and easy. Instead, many men notice a weaker stream, difficulty starting, and the constant feeling that their bladder is never completely empty. Over time, these changes disrupt daily life. Sleep gets broken because you wake up again and again at night to use the bathroom. Energy fades during the day, and even simple trips outside the house become stressful because you're always worried about finding the nearest restroom. For millions of men, BPH isn't just a medical issue. It's a daily frustration that steals comfort, rest, and confidence. Lifestyle changes can sometimes help, like drinking less in the evening, cutting down on caffeine, or training the bladder with scheduled bathroom visits. But once the prostate grows beyond a certain point, these adjustments are rarely enough. That's when most men need medication to get real relief. The first line of treatment doctors usually prescribe are called alpha blockers. These medicines don't shrink the prostate itself, but instead they relax the smooth muscle in the prostate and the neck of the bladder. Imagine loosening the tight grip around that garden hose. Suddenly, urine can flow more freely, with less pressure and less effort. For many men, the improvement comes quickly. Within days or weeks, they notice fewer nighttime bathroom trips, a stronger stream, and less of that constant pressure in the bladder. But here's the important part. Not all alpha blockers are the same. Some are more targeted to the prostate and bladder, while others affect blood vessels throughout the body. That means the choice of which pill you take can make the difference between relief with minimal side effects, or relief that comes at the cost of dizziness, low blood pressure, or other unwanted problems. Doctors today have several alpha blockers to choose from, but they don't all work in the same way. The most targeted medicines are tamsulosin and silodosin. These are called uroselective because they mainly act on the receptors in the prostate and bladder. That means they focus on the problem area without spreading too many effects to the rest of the body. On the other hand, drugs like doxazosin, terazosin, and alfuzosin are less selective. They still relax the prostate, but they also relax blood vessels. For men who also have high blood pressure, that can be a bonus. But for many older men, the risk is higher: dizziness, fainting, or even dangerous falls, especially when getting up at night. There is also a medication called naftopidil, mainly used in Japan, which is very specific to prostate receptors. It's not widely available in other countries, but studies suggest it can be very effective. When researchers compared all these drugs across more than 20 clinical trials, involving over 3,000 men, one medication consistently came out on top: tamsulosin at a dose of 0.4 milligrams. It gave the biggest improvement in symptoms, the best increase in urine flow, and the greatest reduction in leftover urine in the bladder. In other words, it helped men feel better and empty their bladder more completely while still being well tolerated. For many doctors, this makes tamsulosin the strongest first choice. Of course, no medication is perfect, and alpha blockers are no exception. The most common side effects include dizziness, lightheadedness, and a sudden drop in blood pressure when standing up. For older men, especially those already waking at night to use the bathroom, this can increase the risk of dangerous falls. Some men may also notice headaches, shortness of breath, or fatigue. Another concern is sexual function. Certain drugs, especially psilocybin, are linked with a higher chance of retrograde ejaculation, where semen flows backward into the bladder instead of out. It isn't harmful, but it can be frustrating or concerning. By contrast, alfuzosin has one of the lowest rates of ejaculatory problems, making it a better option for men who place high priority on preserving sexual health. There's also something called floppy iris syndrome, which can complicate cataract surgery if you've been taking these medications for a long time. That's why it's important to always tell your eye doctor if you're on an alpha blocker. For many men, prostate problems don't come alone. Erectile dysfunction often shows up at the same time, adding another layer of frustration. The good news is that one medication can sometimes help with both. Tadalafil, also known as Cialis, taken in a low daily dose of 5 milligrams, has been shown to improve urinary symptoms from BPH, while also supporting stronger erections. For men who already use it for erectile dysfunction, this can mean one pill that addresses two problems at once. There is also some evidence, though limited, that certain alpha blockers may slightly improve erectile function. For example, naftopidil, used mainly in Japan, has been linked with better erections in some studies. The theory is that its highly selective action not only relaxes the prostate, but also improves blood flow in the penis. While this medication isn't available everywhere, it reminds us that the right drug choice can sometimes do more than one job. What matters most is this: prostate medication isn't one size fits all. Your doctor should look at the whole picture: your urinary symptoms, your risk of falls, your blood pressure, your sexual health, and even other conditions like diabetes or heart disease, before choosing the best treatment. So here's the takeaway: prostate problems are common, but they don't have to control your life. Among all the options, tamsulosin at 0.4 milligrams stands out as the best balance: strong symptom relief with fewer side effects. But remember, the right choice depends on your unique needs, whether that's avoiding dizziness, protecting sexual health, or managing blood pressure at the same time. If you're struggling with these symptoms, don't ignore them and don't just accept them as part of aging. Talk to your doctor, ask about your options, and find the medication that truly fits you. You deserve restful nights, confident days, and a life not ruled by the bathroom. And if you found this helpful, make sure to subscribe for more clear, practical health advice, because your health at every age is worth protecting.